Hello, 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 hello. Okay. I enjoy talking to y'all. I really do. Oh, yeah. I can't help but be Mama Bell. That's me. I always say, Lord, till the day I go home, let me continue to pour out. I don't want to leave holding nothing. I don't want to take nothing to the grave with me.
I say some people wonder why they get old. And they say everybody is looking like they've been through life twice. It's because you have so much eating, so much stress.
Baby.
I know some people 30 and looking 60.
Yes.
Go.
Let it
Go eat dinner by yourself. Because at first I was the type I didn't even want to go eat. Now I will go sit and eat by myself. I love when I go to the nail shop or pedicure. That's my time to just go. Sometimes you can go by yourself and then just give you a time to just, like you say, one on one with him.
There you go. There you go.
But not in the house. You see what I'm saying? Go out by yourself.
Yeah. Go get your nails done by yourself. Just one. Just one, two.
Wow, that's it.
Find your nail shop, serve you some wine. Get some shit.
Yeah.
Let it loose. You be like, okay, get in the car, going home. Mommy again. Okay.
They on mommy mode. Yep.
Mommy mode again.
They should take my phone.
Yeah. Oh, that's sweet. That's fine too. That's fine too.
Where we go, they have a seat for the kids.
The princess area,
Yeah,
I've seen them.
yeah. She's like, oh, here to relax. It was cute.
Yeah.
It's gonna be memories. Mom, we used to go every Thursday. You know how we grow up. Say, oh, mom, every Saturday we used to go to this. You know, they be memories for them. That's why I can't wait for they boys. So I'm not living with them. But y'all got girls. They gonna remember that type of stuff. Yeah.
Okay, so let's see here. Let's talk about cases, working with cases, creating cases in chapter 5. So when you're creating cases, you're creating and learning things in layers. It's just like English in reading, it's just like math. You know, you learn your basic foundations, your basic math, and you move up to problem solving, integer rules, PEMDAS, pre-algebra, algebra 1, algebra 2, calculus, theorem. You know, you learn math in layers. Well, it's the same thing with this. So you're gonna learn this in layers, and I think we talked about it, so I'm kind of speed up through it. From the last conversation we had on Monday, did y'all have any questions for me? Any questions for me? Okay. So be familiar with your tabs of where everything goes in Medisoft. Yeah, in Medisoft. Okay, so the assigned provider and the referring provider. So let's talk about that for a minute. I'm on page 166, the account tab. The account tab, page 166. Which one of these right? I keep forgetting. Okay, it's this one. Okay, so the assigned provider. Okay, that assigned provider is the primary provider. Primary provider of care. Okay, now primary provider of care, that could be like family practice, that could be internal medicine, general practitioner, okay, sometimes you may have OBGYN as a PCP, okay, and for men, a urologist. Now, urologists also see for kidney and bladder issues and things of that nature, but they also can be a PCP for men, testicles, stuff like that. Okay, so now we have the referring provider. Why do you think it's important to learn about or acknowledge the referring provider? Who is the referring provider? What are they about? Specialists. Mm-hmm. They can be the specialists, okay, to see a specialized, well, let's say issue, specialized issue. Now, they can also be referred to another PCP, okay? And when I say PCP, I mean these folks up here, okay? For a second opinion. Okay, or consult, which is still a second opinion. Okay, or even another specialist. Doesn't have to be a PCP, be another specialist too. Okay, just to be for sure, just so that and normally a doctor themselves would not refer out for a second opinion or for a consultation. That's usually upon the patient's request. You know, I would like to get a second opinion. I would like to get a third opinion. There are some folks that ask for a third opinion, because they can be in denial and just don't want to acknowledge that they got the problem. Okay, well, ma'am, here's a list of my colleagues. You tell me which one you want. Because I done already sent you to somebody else, then you got me telling you, so I'm gonna let you choose. Okay, so you won't think it's just us talking. Okay? All right. Now, those are referring providers. Those are necessary, let me write a key here. They are necessary. I think necessary is with two C's. Okay, necessary to report on HCFA. Why am I saying HCFA when it's not? On a CMS 1500 form, okay, for reasons of filing. Okay, reasons of filing. So just in case they request, and you have to acknowledge on one of those boxes on the CMS 1500 form. Remember how we went through the CMS 1500 form? We went through box by box. They have a box for the to put the referring physician's name there. Okay, so just in case they request medical records, okay, for that DOS. DOS means data service. They will understand why. Okay, it'll all make sense. Okay, now, look on the page 166, how they have assigned provider. They have assigned provider number 5. Now, that's not like extra stone. That's created for that particular practice. Okay, you can imagine, if you will, if you're working for CiMO clinic, you can have doctor number 500. You can have doctor number 4 or 5. When I worked for CiMO back in 1990 through 95, I remember where Dr. Mavis P. Kelsey was doctor number 1. Dr. CiMO was doctor number 2. Doctor 3 was Dr. Condit. No, was it Dr. No, Dr. Condit was doctor number 4. I forget, I see that man's face. He was doctor number 3. Doctor number 4, doctor number 5 was I see this other guy too. I can't even get his name, Jesus. Dr. Tabuada was doctor number 6. He was occupational medicine. I used to work in his department sometime. Doctor number 3 was, no, doctor number 4 was Dr. Hughes. Dr. Hughes, Dr. I. Hughes, my sorority sister's husband. He was a gastroenterologist. So every time they acquire a new doctor, be it fresh out of medical school or while they're doing their residency or something like that, they get a doctor's number. So it's amazing to see how much they have grown. You know, so if you see a doctor's number, sometimes you can look at their lab coats and they don't have their name, but in front of their name, it'll be a doctor number, like 500. Yeah.
It's just
All the doctors since the day of time. It adds up. Since the day of time. Yeah, yeah. The church where I got my license to preach, I think I'm minister number 54, and I got licensed in 1999. So you can only imagine what minister number they have now in 2018, and I was number 54. So, and I thought that was quite unique. But it kind of lets you know how much, you know, the company or the ministry has grown. It's very good. So I just wanted to share that with you. Referring provider number is 12. Now let me try to just justify what number 12 could mean. 12 could mean, it could be again like Kelsey CiMO. We had different specialists, even though they came on and they took on the next sequencing number, they still, how can I say, practice within their realm of specialty. They just got that sequencing number, right? So if they under that same Kelsey CiMO practice name, then they're doctor number 12, but they are the specialists of whatever area that they practice. But they doctor number 12 underneath that general practice name. I'm hoping I'm making sense, right? Okay. Now another thing, how it could be doctor number 12, within, you could work for a 3 practice physician office that's nothing but 3 PCPs all together, but yet you have a list of colleagues that you refer to. Because like my doctor is Dr. Michael Chang in the Woodlands. And so whenever I have an issue or a patient has a certain issue, he refers out. So I needed a neurologist for the migraines that I was having, right? So he has a sheet that's divided into 4, and it has this specialist, that specialist, this specialist, that specialist that deals with neurology. Okay, so they may be doctor 5, 6, 7, 8 on the list of referring doctors that they sent out. Okay, so it doesn't mean that they're necessarily part of their practice; they just part of their referral team. So it could be one or the other. Are y'all getting that? Okay, so I just didn't want y'all to think and have it etched in your minds that it's just part of a practice. No, it could be a list of doctors that their doctor uses friends to refer to. Okay, so now we have, look here at the bottom where it says visit series, okay? And then it has authorization numbers. And then the last visit date was September 3rd, 2018. And then the last visit number is 3. Authorized number of visits is 100, okay? So sometimes you will get that depending on what that is. So let me write an example of an authorization number. I'm going to write it at the bottom here for the sake of the space. Okay, so you may, hope y'all can see this authorization number. Let me finish it in green because it's red, it's not that great. Okay, say like the authorization number is, I don't know, X, Y, Z, 1, 2, 3, 5, 6, 7. I'm just making up one. And it has an allowance of 3 office visits. Expires, what's today? Today's 16th of August, November 16, 2018. Okay, so they have 3 office visits. Okay, so that means now they don't have to use one once a month to be used up to November 16th. They don't. Okay, they could have one today for today. They could have another one, let's say, the last Wednesday of this month, or Thursday or Friday of this month, whenever. And then they may have another one September 7th. Okay, so you've already used up one today. You've already used up one the last Thursday of this month, and you're going to use a third one, say like September 7th. So you've already utilized what? All 3 of your office visits. You can call the insurance company to ask for an extension. Okay. Ask for an extension. So now what they do is they're going to take the same number, okay, and they're going to give you another 3 office visits, and they can do it as much as they want. And instead of November 16, December, January, February, it'll expire 2/16, 2019. Okay. Now let's suppose the person is doing okay, but let's suppose they had a relapse. Okay, and that person seen a doctor October 12th, for this second round of 3 more visits. Okay, and they're doing okay. And let's suppose they had a relapse. It's after the holidays now. Can we still use that same extended authorization number? Bobby, your first mind.
Oh, you say you asked me a question?
Yeah.
Yes.
Yes. Yes, you can. So if that person seen 1 out of 3 in October and you got 2 more left, and it's after the holidays, it's now January 7th, and oh my goodness, he had a relapse or she had a relapse, can that patient be seen under the same authorization number? Yes, because they have 2 more visits left within that extension. So yes, you can. Yes, you can.
So as long as I'm guessing, before and after the extension, like say if they was not to give her an extension, she didn't need it. When that first one is over, like 11, 16, 18, do they then get another authorization number? Is that authorization number just for that time period?
Is for that time period for that year, but you can use that same authorization number and get another extension and 3 more visits.
Okay, so anytime you get an extension, it will be with the same number?
Yes. Yes. It keeps the insurance company and the provider's office from being confused. And it keeps everything in one paper setting. Yeah, exactly. Now, another question you had was, what if that person used up all their office visits? Is October 16? They've been okay for the remains of the 2018 year. Let's suppose they get sick again with the same specialist, and oh my goodness, they need to see the doctor. Okay, and do I get a brand new authorization number, or can I ask for a fresh new extension? And it's now January 7, 2019. You can ask for an extension of the last year's authorization number.
Okay.
Yeah, you can. Now, it'll be totally up to the utilization review department if they want to give you a new number for that new year. It's up to them. but to keep all the paperwork in line under, how can I say, under one authorization number, it's just good to use the same one. At least that's what I did when I was in utilization review. You know, it just kind of kept down the confusion.
It's kind of, I asked, kind of sort of with the prescriptions, when they come get their prescription. You have some that close out. And I'm like, instead of doctors rewriting a prescription, we'll either send a fax to the insurance company at Walgreens, or we either contact the doctor. And I was asking, I wasn't asking, I'm like, I know they probably use the same number because all they do is resubmit.
Mm-hmm. Mm-hmm. So when and it's very good because some medications, like my husband uses Glyzambi.
Mm-hmm.
Okay, it's very expensive. Even with the insurance, he pays $35. Okay, and the doctor's office have to get an authorization for that prescription to be approved under Express Scripts to pay for it, right? And so when he runs out, hold on, sweetie. When he runs out, where was I going? They have to call back to the doctor's office to get them to resubmit to the insurance company to either to approve it, right, and to get an extension of that authorization, that same authorization.
So it's just the extension of that his same authorization, because it'll pop up like WCB, and that's basically letting us know we're waiting on the doctor to give us a call back because the prescription was closed.
Yes.
Okay.
Yes. Very good. Very good. Absolutely. So that's who normally has to do it. Now, sometimes on your end, you can call the insurance company and advocate for the patient to get an authorization number, and they can call or send a request over to the doctor's office to say, hey, we need y'all to, can you send us? And sometimes they know to ask, we need progress notes to justify why we need to extend this, how they're doing. You know, there's no saying that they're doing okay. And then they have registered pharmacists on staff at the insurance company, just like they have doctors and nurses that do administrative work. They have registered pharmacists at the insurance company that can justify that. Oh, yeah. Oh, yeah. Oh, yeah. Pharmacy techs, too. They work for insurance companies, too. When I worked for Today's Options, it was off of Richmond and the Beltway. First, they were near West Park, where Boudreaux's is, where HTC is over there. And then they outgrew that building and they moved out of Richmond and the Beltway. But we had a department of pharmacy and pharmacy tech, and we had a department of insurance claims examiners that process claims for pharmacy. Yeah, we had it there, and we had it at First Health when it was First Health. Now it's called Coventry, which is under Aetna and Spring. But they're located off of JFK Boulevard and Independence Drive. And it was part of Coventry. Coventry is like a branch of Aetna. Anyway, back in my day in '95, we had those type of claims examiners and pharmacy tech and pharmacists there too. And utilization review would be on a different floor from the claims examiners, and the auditors would be on a different floor, and the adjusters would be on a different floor. I love the insurance industry. I just did. Anyway, so that's so much for that. But that's good. That's a good question, and I really could see that you'll thrive well in that revenue cycle thing with the billing and the coding, especially. I don't know what it is, but it's like I can see you doing well with collections, money, like finding the money, like digging, like mining, data mining. It's part of data mining, but it's kind of like you can find it, and once you figure it out, it's like, bing, here all the money falls. Yeah, because you have to be nosy for a job like that. You got to be nosy, honey. Yeah, And I was like that. I loved it. I love finding money. So I could really see you doing like data mining in revenue cycles, meaning finding authorizations, but I can see you doing collections. I really can see you doing that and prospering that. But you gravitate to that really fast. You tend to absorb things really fast, and then people come to you for consult and advice. So that's going to be your thrust, if you will. Yeah. Okay, so see where it says authorization number here? Now, they don't have a number on here, but when you do call for that, that's where you put that. Okay? Are y'all getting this? So when how important is this? Well, I'll tell you why it's important. When the person calls to verify insurance, when the person calls to verify the appointments, they need to make sure all this is taken care of before that patient comes. You can always get a retro on for an authorization number to cover that data service. You can do that. I've done that many times. And you can also get an extension to cover for that data service. Okay. But it's always good to look. That's why you have people, if you have an appointment on Friday and it's Wednesday, they're calling to confirm your appointment or they're looking at it and everything. Are y'all getting this? And so you got to make sure everything's taken care of because you don't want the patient getting a bill for something that the insurance company should pay for. Okay. All right. So moving right along. It's just telling you, okay, the facility, the supervising provider, the referring source, the facility, the attorney, in case there's an accident or a lawsuit going on, blah, blah, blah. Okay, moving right along. Primary insurance carrier. Okay, that's real important. Now, remember what I said earlier before. Coordination of benefits does not apply to couples. Okay, themselves, the adults themselves. If Janie Sue has insurance and her husband has insurance on her too, then Janie Sue's insurance go first and her husband's go second. If Billy Bob has insurance on himself and Janie Sue has insurance on him and he's seeing the doctor, then you have to file on Billy Bob's insurance and Janie Sue's second. There is no coordination of benefits with that. Okay, not in that instance. There are other instances, but for the most part speaking, not in that instance. Now, if there's children involved, coordination of benefits is the only time that would apply because of the what kind of rule? Birthday rule. Thank you. Y'all got it. Hey. Okay, so y'all gonna see more of that, blah, blah, blah. So we're moving on, blah, blah, blah. Okay. Insurance coverage percents by service classification. Capitated plan. Capitated plans are known under HMO. Okay, they're not known under PPO or EPO or point of service. They're only known under the HMO policy. Okay, insurance coverage percentage. Those are calculations you're going to find out under the MediSoft software. You're going to see that there are automatic calculations. Sometimes you may have to kind of fix it a bit and don't quite calculate correctly because it has not been updated for that following year or at that time. So beware, just kind of watch your calculations every now and then. Crossover claims. Let's go to page 172. Let's read what that is. Crossover claims are claims that are processed by Medicare, then transferred to Medicaid or to a payer that provides supplemental insurance benefits to Medicare beneficiaries. Medicare secondary reasons are required when another payer or insurer pays on a patient's claim prior to Medicare. Medicare secondary reason. When Medicare is the secondary payer and the reason is indicated in this field. Crossover claim. A check mark is in this box. It indicates that the claim is processed by one payer, such as Medicare, then automatically to a second payer. Now, that alludes to this. to this conversation. Okay. Primary pay. Primary payer, which is, in other words, primary medical biller. Okay, you might see that out there. Let me explain what that means. Okay, then you have secondary payer, which is secondary medical biller. Okay, primary medical biller are going to be your what they call first time filers. Filers, okay, to the insurance company. In return for possible pay and explanation of benefits, okay? Secondary will file with EOB from the primary insurance, okay? Along with the CMS 1500, okay? For processing of payment, okay? Payment, possibly, can't guarantee that. Get at this point, can't guarantee that. Okay, so what you do, you can send this hard copy sorry, it'll go, sorry. You can send this hard copy or soft copy. Who knows what I mean by hard copy and soft copy? Yes, one is paper and one is electronic. You can send this by paper and you can send this by electronic. EDI, electronic data interchange. Okay. With this, if you send it by paper, there should be no penalties for this. There should be no penalties for this. Okay. Remember we talked about, meaningful use. Let me talk about meaningful use. I'll come back to this, but y'all need to understand that in billing and electronic. It affects EHR, electronic health records, and EDI, electronic data interchange. Remind me to talk about that. Okay. Let's see here. Sorry if it's sideways. Okay. So here has to be filed EDI for MI, meaningful use. For meaningful use. Meaningful use will stop possibly in 2020 or 2021. Okay? If continued CMS 1500 hard copy filing, there will be a penalty. Okay, penalty. Okay, and that penalty could be 1% of provider pay. So a lot of times when you're working for a provider's office and you're reading the EOB, and then they're going to say, so for example, it's going to say 1% penalty deduction. You would know automatically why. So let's just say, for example, that doctor is going to get paid $1,500 for this one particular, no, let's see, about 2 patients, okay? One percent of this, 1% of $1,500 is, what is 1% of $1,500? What is 10%? What is 1% of $1,500? 1%, let's do the math. So let's do 1,500 times 0.01. 1,500, remember you gotta move the decimal over 2 places to the left. It's $15. $15. Okay? And that's just for 2 patients. Can you imagine if he keeps doing this, how much this would add up every time? Okay? And the doctor comes back, oh, it's just $15. Well, yeah. Now just imagine $15 for 10 patients, that 20 patients, 30 patients, 40 patients, 50 patients. Doc, that's somebody's salary. That's somebody's paycheck. You taking that lightly, but we need to get on the ball, Doc. We need to get involved with meaningful use. All meaningful use is saying that we need providers to file electronically. That's all what they're saying. For smooth flow purposes. Okay? For smooth flow purposes. All right. Now, doctors, they get incentives. Incentives. Yes, they do. They get incentives. Now, they started the incentive for meaningful use. I want to say, long before I had my client. I think they started it 2009, 2010. Let's see. I was at Methodist 2012, 2011, 2010. Doctors back then would get like $80,000 incentive from the government, from CMS. just for using electronic data interchange. Whatever software they use, electronic data interchange. Now, basically in a nutshell, and I'm going to circle off this space here, electronic data interchange could be, let's say for example, Medisoft, okay? And it goes through a clearinghouse, okay? And that clearinghouse, by example, could be a company called Availity. Availity has been around for a long time. And then it goes to the insurance company. And that insurance company can be commercial insurance, or Medicaid, Medicare. Got it? That's all what electronic data interchange is. It's going from one uh, one software engine into another software engine into another software engine. From one computer to another computer to another computer and back to the doctor's office. All being interchanged through portals. Okay? That's all that really, really is. Okay, so meaningful use now for doctors that get on board with CMS. CMS is the one that brought up the meaningful use. So now that doctors get on board for meaningful use, instead of them getting $80,000 for an incentive, they're probably getting like 10. Well, no, because they're going to slow it down in 2020, 2021. So they probably get about like 19,000. But come 2020, the year 2021, it'll probably be reduced down to $5,000 or $8,000 incentives to use electronic data interchange. After that, they're going to start being penalized because we still got people doing paperwork and we trying to do things electronically, and you're making it hard for us, and you're being stubborn. So we're going to have to penalize you for you being stubborn because you don't want to change. You don't want to get on board. So guess what? We're going to hurt you, hit you where it hurts, in your pocket. Okay.
Workers on Friday, get don't go they try to go out.
Yeah.
They was upset they had to switch over.
Yeah. Okay. Oh my God. And psychiatric.
I just been so scared. Even. I bet if that doctor may not have nothing to do with that, he probably put his trust in somebody to dispose of him. I got him. I'm gonna show him.
Yeah.
You never knew the news exposed you.
Yeah. Oh my God. It's, you know what? Being a physician, it can be a very gratifying thing. But when you trying to hire people, when you hire people to trust your business, your work, and they sloppy, and that's what I was trying to do with my client. I was trying to have meetings with her, and I'm like, ma'am, I know you're busy, but I need you to really pay attention. I need you to read your email. You may not understand everything, but if you just read it, glance at it, read it again later when you really got time. If you don't, you're going to have people, I'm sorry, in your office, they're going to screw you over. And you'd be amazed how many broke working positions there are. Very serious. No joke. Very serious. Okay, so what I'm going to do, ladies, is about 11:15. I'm going to go ahead and let y'all work on your work. What did y'all stop at as far as your work? Well, I know y'all just got started, so y'all back on chapter 3, right? Are y'all trying to work up? Because you have to start there. You can't just go in the middle of chapter 4. Oh, okay, okay. Well, we'll do 3G together. We'll look at that. We'll do that together. So, but don't skip chapters. You have to do chapter by chapter because it layers as you do the work. It's going to all come together and make sense. Okay? All right. Well, this is Mrs. Harper. We are through talking about Chapter 5, building cases. I hope that this has been helpful for you. If you have any questions, please post your comments down in the sections tab. You know my contact information, thcod@hotmail.com. Uh, and I just want to say, let this be a joyful day for you and others for your health information. Thank you so much, and we'll see you next time.